I'm an Iowa farm girl. Grew up in Iowa. We live here in Van Meter. My husband, Mike, we've been married 16 years. Is that right? Or is that 18 years? It's 18. We have 2 daughters. They're in their 30s. We have 2 grandchildren with a third on the way. We just work on the farm together, which is really nice. We garden together, give hay to the horses together. We had been gone to Asheville. I was on vacation. I knew something was wrong when we stopped to eat. And I couldn't eat much. I'm like, I have not eaten all day. And I developed bloating around my abdomen. And I'm like, I need to go to the doctor. So I went to my PCP. She did an exam and she said, Jana, I think it's ovarian cancer. I said, how is that? Ovarian cancer? Where did this come from? And I remember just playing it over in my head. Cancer.
In a blink of an eye, our lives changed. What was important is no longer important. And it was tough. It was tough.
I had chemo for 3 rounds, and then I had a full hysterectomy. And then symptoms started in again. I tolerated most of the drugs well. The cancer just became resistant quickly, going day by day. And that is a common saying around here, one day at a time.
You have so much information thrown at you, whether it's the results of a CAT scan or a person who's had cancer tells you what you need to do and so forth. And it can be so overwhelming.
Probably where Angela came into play was helping me know what to anticipate. The first chemo treatment, she came into the room and she was a pleasant surprise and a great deal of comfort.
Jana is courageous. She's a fighter and she's strong. She never gives up. I look up to her. I could talk to her for hours. What I tell patients is, hey, I am not here today to overwhelm you. I am here today to be here. I know that I cannot take it all away, but I would like to take out as much anxiety out of the picture as I can.
She prepared us for what we could expect, what next steps might be. To fill that gap that I didn't even know it existed was fantastic.
When we think of the experience at Stoddard, we think of it through the lens of a patient. So as a patient, what do I want out of the cancer center? I want expert care. I want good physicians. I want caring physicians. We have that. I also want people to support me in my whole health, my whole life.
Over the years, people have separated the head and the body as 2 separate things, which is not the case. One definitely affects the other.
So my job as an oncology nurse navigator here at John Stoddard, we have a lot of services, and I was able to get a lot of those connected for Jana, and boy, did she use a lot of those.
I am so thankful Stoddard has integrative services. The writing was the first one I did. I'm an accountant. I'm not a writer. But I thought, no, I want to do it. I want to learn. I don't journal or write every day, but boy, when I find myself ruminating on my care or my situation or whatever it is, I get it out and I can all of a sudden move on. I also did the art program, and I find when I am painting, I am thinking only of painting. I'm only thinking of creating. I swear my pulse is lower. I'm calmer. I'm peaceful. Little things like that gives you hope that, oh, I can be good.
Something else that we were able to give her information about was a mindfulness based stress reduction course. And so pretty much all the patients at some point have some level of anxiety with a cancer diagnosis, as you might imagine. Having things like that available to patients is really important to us. So we were able to get her connected with that service.
When I first learned of these therapies and what was offered and realized that there was no charge or fee for the service, I was shocked because what's free? Nothing. And what a good message it sends to patients that John Stoddard's interested in your healing, not just in your treatment, but in your overall healing as a human being. To all the donors out there, I just want to say thank you. Just the gratitude and the appreciation.
I just want everyone to remember that we're here to care for you at the John Stoddard Cancer Center. From the day you walk in our doors for the first time, literally for the rest of your life. So when you're done with your treatment, you're not necessarily done with us, because we're here to support you through your entire journey.
As a nurse and family member of patients, we are so grateful for the opportunity to be able to offer these things that help people feel more like people.
Thank you so much for what you do for our patients here at John Stoddard.
A big thank you to anyone and everyone who's contributed to any fund that helps us with all of these services, because without it, they don't exist.
I hope they know that they touch people at a very tender time. They make a huge difference.